Good afternoon from Tamaki Makaurau, Auckland. I'm Murray Bruges. I'm the director of the Helen Clark Foundation. Welcome to today's webinar exploring junk food, obesity and public health in New Zealand with a stellar panel of experts. The Helen Clark Foundation is an evidence-based public policy think tank, and we're funded by our members and by donors. If you're already a member of our foundation, thank you. Your membership fees enable us to stay independent and help support us to put on important conversations like today's. If you're not a member, but you want to help ensure New Zealand has smart, equitable policy in place for the years ahead, please do consider becoming a member, which you can do at the link in the comment section that my colleague Victoria will just be posting shortly. Membership is only $65 per year, and concession membership is only $35 per year. That's if, for example, you're retired or a student or not on an income. Your support really helps us to do this work. One other reason to become a member is that several times a year we run member-only webinars. And this year we're looking to do a year-end Ask Me Anything webinar with our 4 honorary fellows, Professor Jonathan Boston, Lucy Castles, Stephen Jacoby, and our newest honorary fellow, the former Mayor of Hamilton, Paula Southgate. This webinar will be a chance for our members to ask our expert fellows why this country works the way it does, and to discuss the areas where we could be doing better. So please keep an eye out for an invite to that webinar later this week. And I think that that webinar is very likely to be scheduled for 12 p.m. On Thursday, the 11th of December. As always, a customary reminder that today's webinar is not a normal Zoom call. Your cameras and your microphones are turned off for the whole session, and you can drink your coffee and eat your lunch, safe in the knowledge that no one can see you or hear you. But that doesn't mean you can't participate in the conversation. We really do hope you'll get involved, and the best way for you to do that is to put your questions for our panelists into the Q&A function that's at the bottom of the screen, and I'll put those questions to our expert panelists at around about the 12:40 mark. You see we also have a separate chat function, but please put your questions in the Q&A function. You can also vote on other people's questions, so the more votes a question gets, the more likely it is to be asked. So on to today's session. This foundation is focused on developing solutions to New Zealand's long-term challenges, like adapting to climate change, our declining social cohesion, or ensuring we have the right kinds of infrastructure in the right places. Today's webinar looks at the long-standing issue of New Zealand's high obesity rates and the various factors that have caused that, and in particular, the kinds of policy changes we should consider making to address that situation. So I'll now ask our panelists to introduce themselves briefly, starting with Dr. Bloomfield, and we'll then get into the discussion.
Oh, thanks very much, Murray. Kia ora koutou, Ashley Bloomfield. I'm currently the Chief Executive at Public Health and Forensic Science. I'm a public health physician by training, and whilst more recently I've sort of had a bit of a reputation in the infectious disease control area, actually my professional area and where I've spent most of my career is on non-communicable disease prevention and control.
Thanks, Ashley. Cleona.
Kia ora koutou. My name's Cleona Niwuruku, and I'm a Professor of Population Nutrition at the University of Auckland, a clinical dietitian by background, but most of my research focuses on food policy and scalable ways to support people to eat more healthily.
Thanks, Cleona. Dave.
My name is Dave Latele, and I'm the founder of a group called BBM Motivation, really a grassroots group that's helping thousands of people across New Zealand with living healthier lifestyles.
Thanks, Dave. And coming to us at 4 a.m. in the morning from Kazakhstan, Adam.
Hi, I'm Adam Bradshaw. I'm a Senior Policy Advisor at the Tony Blair Institute, substantively working on health and prevention, normally based in London, but currently country lead for our Kazakhstan team.
Thanks, Sam. Really thrilled you could join us today. So we'll start with a bit of a framing question, and I will ask Cleona to start, and then we'll go to each of you just for your quick reflections. New Zealand's obesity rates are among the highest in the OECD. That's the group of countries that we like to compare ourselves to. So why is this issue so pronounced in New Zealand? And what are the consequences of high obesity rates, both for individuals and for New Zealand society more generally? So starting with you, Cleona.
I think it's particularly pronounced in New Zealand for two main reasons. First of all, we have a food environment in New Zealand that is heavily dominated by unhealthy, ultra-processed foods. These are foods that are readily available everywhere we go. They're relatively cheap and they're marketed very aggressively, particularly to our children. In tandem with that, we have an environment which has very fragmented, weak programs and interventions to try and tackle this problem. Mostly in New Zealand, we rely a lot on charities and individuals and voluntary industry initiatives, and there's very little in the way of strong regulation like we see in other countries like the UK. The consequences are enormous for individuals. It is associated with increased risk of a lot of diseases like heart disease, some cancers and diabetes, but also, some pretty major economic and societal consequences as well. Those diseases lead to high healthcare costs, low workforce productivity, but importantly, big intergenerational effects, because what we eat now carries on through life. So, what the foods our children are eating now are the foods they're likely to continue eating. And if they're living with obesity now, they're more likely to continue living with that as well.
Thanks, Cleona. Same question to you, Dave. Why is this issue so pronounced in New Zealand, and what are consequences of high obesity rates for individuals and for society? Oh, and you're on mute, Dave.
Sorry. We work in some of the most deprived areas around New Zealand. We're in Porirua. We're also in Whangarei, as well as Newland and South Auckland. And these areas, and really any deprived area, you're surrounded by every single bad choice that's available to man. These are health food deserts, fast food swamps, and they are, like we're saying, is that they're really targeted at us. And there's no accident that the most profitable fast food chains are all in the poorest areas. And we're seeing this every day with limbs being chopped off left, right, and centre. I went to a Middlemore hospital last year and visited a guy that had to weigh him on a special bed, weighed 400 kilos, and the system doesn't know what to do. And is it Claire, or I can't see, I'm on a phone.
Fiona.
Fiona? As Fiona said, they're relying on groups like us, charitable organisations with very little funding to do this work. And I always think what the cost would be if we all just stopped. If we all just said, look, we can't continue, it's too tough, we don't have the money to do these things, but we don't, we keep going. The answer is by educating people through programs that people actually listen to. Instead of investing solely, it's always now top down. It's never a bottom-up approach. It's all from the system. It's always top-down. Give them pills, get them operations. When that doesn't break cycles, that's what we're seeing with these intergenerational cycles. When you have 8-year-olds that we're helping that weigh over 100 kilos, so it's really worrying times for us that are on the front line of this thing.
Great, thanks. Ashley, same question.
Yeah, thanks. And, just to build on what Cleona and Dave have said, bringing two really important perspectives, and Cleona did a very nice explainer. The only thing I would add is, and this maybe is something we will explore, and it's an explanation for perhaps why our regulatory environment is pretty timid, to say the least, is we're a country that is very reliant still on primary produce export for our earnings, for our way of life, for our GDP. And so our industry tends to carry a lot of weight and is quite influential. And that, I think, is an important context for us in terms of then what is possible and what would be needed in terms of political courage and political action to address these challenges that we're facing, and why they are particularly pronounced in Aotearoa, New Zealand.
Great, thank you. And Adam, same question.
Yeah, absolutely. I think it's almost like, for me, I find it very helpful to zoom out a little bit and to sort of think about what obesity is actually doing at a macro view. So you're seeing like broad trends across New Zealand, but also across the world, where healthcare spending is just increasing, has been increasing over the past 2 decades, right? While healthy life expectancy gains have been slowing or reversing in many countries. This is driven a lot by these preventable chronic diseases that are crippling health systems, that are effectively making them like fundamentally unsustainable. They're like breaking at the seams. And despite this massive investment, these systems and like broader society are trapped in this vicious cycle of treating this sickness rather than preventing it. And so we end up in a situation where you have people that are living longer, but spending more of that time in poor health. And then for government, like the political leaders, what this really means is that there's anemic growth, there's shrinking tax receipts and spiraling welfare costs. So you're trying to extract more and more money from a smaller and smaller pie because people are dropping out of the workforce earlier, but they're also sicker as well. So they're living with type 2 diabetes, they're living with cancer, they have heart attacks and things like that. And this has serious implications both for our living standards, but also for political leaders' prospects. So it's starting to get to a tipping point where there is both a carrot and a stick for political leaders. That obesity is at the root cause of so much of this. You have type 2 diabetes, cancers, musculoskeletal conditions, cardiovascular disease, mental health disorders. All of these are dragging down the economies and societies, and it's entirely preventable and treatable as well. So that's, I'd say, like just sort of trying to understand like the sort of macro trends that have been driven by this rising tide of obesity. And it's not just like a New Zealand societal issue either. Like we're seeing it in countries like India, Indonesia, obviously the UK. You're seeing like all the trends in the US at the moment around pharmaceuticals that Donald Trump is driving. Even things like that RFK is talking about with Make America Healthy Again. They're all stemming from a very similar thing. But I think so I think it's great to have brought everybody here together to discuss it.
Thanks, Adam. I'll start with this next question to you, Cleanna, and then perhaps we'll move to you, Dr. Bloomfield. Many experts advocate for a commercial food environment that makes it easier to eat healthily, sometimes including via fiscal levers like levies on sugary drinks. I think, clear based on the international evidence that you've studied and same with you, Ashley, how would we expect mandatory measures like a sugar levy or a compulsory front of pack labeling, for instance, like the health star rating that we have in New Zealand, which is currently not compulsory, how would we expect those to change consumption patterns in New Zealand, particularly for high risk populations? I'll start with you, Cleanna.
Okay. A sugar sweetened beverage tax or a levy such as they have in the UK, there's actually there's so much evidence now because so many countries around the world have adopted this as a policy. And what we've seen when we look at the evidence from those countries is a really marked, measurable drop in consumption of the drinks that are actually taxed and shifts to healthier drinks as well. So lower sugar or sugar-free drinks that are not taxed. The UK soft drink industry levy is a really nice example of a tax because they introduced kind of a tiered threshold where there are different tax rates depending on the sugar content of the drinks. And that provided a really nice incentive for industry to actually reformulate their products to make them healthier, to be able to avoid that levy. So we see not just a drop in consumption, but also a reformulation which improves the food supply overall. And interestingly, what we do see with fiscal measures like these kinds of taxes is that low income and high risk groups actually respond very markedly to these kinds of levers. And so they actually tend to change consumption faster and more markedly and therefore benefit more from those kinds of measures. Labeling is another policy that can be really useful too, particularly if it is mandatory. As you mentioned, the labeling system, the front of pack labeling system we have in New Zealand, the health star rating system is voluntary. So it's on only about 1 in 3 products if you go to the supermarkets, and it's predominantly on healthier products. It doesn't tend to be displayed on the less healthy products. So the first impact of making it mandatory would be that you would actually see 0.5 star and 1 star on the least healthy products, rather than just 4 and 5 stars on the healthier products. At the moment, it's really promoting healthier products, but it's not really kind of sending a message around the least healthy products. And labeling as well is another area where it does prompt industry to reformulate products to get healthier labels. So that's something, again, that can influence the overall food supply. It doesn't just rely on people making healthier choices. If industry moves to adopt a healthier label, that's something that can benefit all of us.
Great, thanks, Cleona. Ashley.
Well, I think, again, Cleona's done a lovely overview of the evidence. It's compelling, particularly around the sugar-sweetened beverages tax or the the use of price instruments. And it's hardly surprising. We've been using price instruments for other they used to be called the sin taxes, but tobacco especially and alcohol, of course, has excise on it to help reduce harmful use of alcohol. The impact with tobacco is no doubt been profound in terms of reducing consumption. The challenge here is not the evidence base, and we will come to this. I know the challenge is actually the political will. And whilst one could potentially argue that our reliance on primary, production and effectively, not to put too fine a point on it, we export saturated fat to the world. But in terms of sugar-sweetened beverages, these are hollow calories. There's no particular investment that New Zealand or New Zealand businesses have. The profits are not supporting New Zealanders and the well-being of New Zealanders. So there's less excuse in a way for timidity around putting in place instruments or regulations that could reduce consumption of sugar-sweetened beverages. Many countries have done this. The UK, some years ago, this really is an issue of political will rather than a lack of evidence.
Yeah, great. This might be a good moment to talk a little bit more about the UK's sugary drinks industry levy. And Adam, I know you've spent a lot of time looking at that particular mechanism. From your perspective, I guess we're interested in a few things. Has it worked? It's certainly got a great reputation as having worked quite well, had some very positive impacts. Is that been your experience? And then separately, how was it able to be implemented? Sometimes there can be quite a lot of pushback on these kinds of policies as being, examples of nanny statism, for instance. So how was the industry levy implemented in the UK, and why has it been a success?
Absolutely. So I think that the interesting thing about the soft drinks industry levy was that it's not actually explicitly a tax on the consumer. It's actually a carrot for the industry to reformulate their drinks to include less sugar, so that they didn't actually pay the tax. So what happened is that the large majority of organizations chose to reformulate their products. They didn't have to pay this tax, which actually led to their products being stable in sales. They still sold the same amount of Coke and stuff like that, but there was actually a 35% reduction across the board in sugar sold in these soft drinks. So you're not affecting the bottom line then of the company, and you're not impacting the consumer at the point of sale, which is quite a difficult thing to do, right? If you're trying to impact if you're putting taxes on products, it's generally not a politically palatable thing to be putting taxes on things like Coke, which generally consumed by everybody, right? But will be a regressive tax on people that are on the lowest incomes and are disproportionately affected by obesity and all of the diseases that it drives. So what the result of this was obviously that there was a 35% reduction across the board in sugar sold, and hospital dental admissions were down for children as well. And so this wasn't really a levy to make money. It was really something to help the industry reformulate. In terms of the sort of what made it successful, I think what was really interesting. It was introduced by a Tory government, so a right-wing government. And the way that they were speaking about, I was speaking with the health minister who introduced this, and he was like, the most conservative thing you can do is to actually try and prevent people from getting sick in the first place. because the sicker people get, the bigger the state has to be to actually look after them further down the road. So it's actually entirely the most nanny state approach you can do is just let people run with it, and then we clean up the mess afterwards because it's going to cost us billions. Because in the UK, we did some estimates here that that the cost of obesity and overweight was about £100 billion per year. So that there, if you adjust for a currency, it's like $250 million per year or something, right? In New Zealand, that's crazy. And then even if you take the population out, like New Zealand's like it's crazy, it's ridiculous amount of money. And we went to the Chancellor with this, the Chancellor of the Exchequer, in the previous Tory government, and he said that this is probably an underestimate as well, that it probably costs us a lot more. And so they were thinking about this both in terms of the health impact, naturally, but as a politician, it's very hard to get elected just on things that you do for people's health. You also have to think about the bottom line. And they were very concerned about trying to link together obesity and the economics of this, which are inextricably linked because it's dragging the economy down. It's actually impacting productivity, and it's impacting the ability of government to actually focus on other things as well. So I think there was trying to bring together both the health and economic argument, and also try to build a cross-party consensus on this to improve people's lives, but also improve the capacity of the country to operate economically.
Yeah, great. And to date, it's been in operation for a few years now. Is it generally seen as succeeding in its aims, the industry living?
Yeah, it's generally seen as succeeding. I think there are next steps as well that I think that the current Labor government are looking to take around marketing as well, marketing of foods to children particularly, which is obviously a very difficult area to get into with the rise of social media too, and trying to regulate that. But also trying to the current rules in the UK that they're looking to bring in the next few months focus on regulation of specific products. So you can't you might not be able to advertise a Big Mac to children, but it's very difficult then once you do that to then to the regulations as they currently worded will still allow brand advertising. So you can't advertise a Big Mac, but you can advertise McDonald's. And so that's a very difficult area to get into. And so I think, but more broadly, the soft drinks industry levy is there's strong cross-party political consensus there.
Great. Thanks, Adam. Next question for you, Dave. You've spoken powerfully about the fact that unhealthy food is often more accessible and affordable than nutritious meals are. You also work on the ground directly with communities. I wonder if you could talk a little bit about what a food desert or a fast food swamp what those things look like for the families you support. And as we try to improve health outcomes in New Zealand, I wonder if you could reflect a little bit about what are the actions that you think should be led by, for instance, by the government versus the kinds of actions that you think should be led by community groups or by individuals themselves.
Yeah, if you want to know what a fast food swamp looks like, just head out to any poor area the closest poor area that you are next to. Go and have a look. If we look at the thing is, I get frustrated with doing these things, and it's great, but we already know that we already know there's an issue. We know what the answers are. There's evidence to back it up. But like Dr. Ashley Bloomfield was saying, it comes down to political will. It's like they'd rather be popular. This is the thing. You have to make unpopular decisions to change these generational issues. What needs to happen, if you think about diabetes, now I might be off on the exact figure, but it costs well over $1 billion a year. Diabetes, it might be, I think 2.6 billion. I can't remember, but they only spend on prevention 43 million a year. So if you want to have a look what the answers are, you got to invest in programs that are already at the ground dealing with prevention, not investing in police cars and ambulances at the bottom of the cliff and waiting for us and dealing with it then. A lot of our people that we work with they don't have a GP, and they don't go to the doctor. They present to the hospital when it's almost too late, costing millions and millions and millions of dollars and costing lives. invest in these groups that are already making a difference, groups that have the support of you wrap around the system, the health system, the social system. Health is more than exercise. Health is more than just eating healthy. It's having access to education, having access to health, having access to housing. All these things are health, right? Te whara tapawhā. And that's what you've got to do. You've got to support these groups that are doing this. And we wrap around this, social workers. We wrap around. We went out and hired our own psychiatrists because the wait list is just too long for our people. And we have nutritionists, dietitians, and all these things. That's the answer. I have all these people from Te Whatu Ora coming. They don't give us much money. They come and see us and looking at different models. Said, well, we have the model. It's right in there. It's working already. And that's what the frustrating part is, because we have so many meetings and I meet with all these different health professionals. We already know the answer. We have all the evidence to back it up. All we need is a government with the balls to actually to take it up and actually take action. And that's what needs to happen. So I get quite fired up about this, but we see the people dying, that people dying of heart attacks. We see it every day, we've just got to wake up and take action, and just do it. We know it works. We know what we need to do. We just got to do it.
Yeah. Okay. I'll start. I'll come back to you, Dave, with the next question, and then perhaps to you, Dr. Bloomfield. New Zealand's unhealthy food environment, I think it's well established, disproportionately affects Māori and Pasifika populations. In your opinions, how should the government, in partnership with Māori and Pasifika, structure its approach to junk food and obesity to address these inequalities? If we start with you, please, Dave.
Well, I think how is it allowed to have more and more crap fast food joints opening up in our towns? How is it allowed to vape shop? Every single vice that's available to us is right at our fingertips. How are we allowing more to open? Why are they not being made to give back? If they're going to be there, why aren't they not being made that a portion of their profits has to go back into schools, has to go back into programs like ours that are making a difference? The answer is, and I keep harping on about it, the answer is support groups, give them money to do this work, and we will save lives and save money in the long run. We have an impact lab report. We're not alone. We just have a high profile. We have an impact lab report that shows a $13 return for every $1 invested. And yet we still struggle to get long-term sustainable funding. If you want to make a difference, support community groups, support charities that are there with not just 6 months, not just 1 year funding, support them with multi-year, 3-year funding so we can actually plan, and it's walking alongside these families long-term to make a difference. This doesn't happen in 3 years. It doesn't. This is a generation thing so that life is better for all of our grandchildren.
Maybe I could just build on that. Thanks. Just to talk with you, Dave, and you can see the messages coming through. And the great thing about you, of course, is we can sense your frustration, but also the passion. You've turned the frustration into actually action, and you're doing something about it. So that's why all those messages support. And I have to just lean in as well to talk what you're doing. I guess just to put the context around this, 50 years ago we didn't have an obesity epidemic. This hasn't happened because suddenly people have started making bad choices, and Māori and Pasifika have started making worse choices than everybody else. That's not the point. That's not what's happening here. The environment has changed, the context changed, and we've let it happen on our watch. And I dare say the Ottawa Charter for Health Promotion has been no help here, because that was written in 1987, and we've got to do something different. What is really needed here is a clear understanding as a society, including our politicians, that it is in our best interests as a country to ensure that our children grow up well, able to fulfil their potential, and also able to be active contributors to our workforce. And you've raised this point, Adam, and this is the big challenge. And we've already challenged with ageing populations, a lower proportion of working age adults able to support superannuation, healthcare costs, and so on. Where it's in our very, very best interest as a nation to ensure that our children, in particular our Māori and Pasifika children, because we have a young Māori and Pasifika population, and that is growing, that is going to be an increasing proportion of our population. It is in all our interests, including the interests of our industry and our private sector, to actually ensure that our food environment is one that generates a healthy future population. I guess, just a message of hope, which we need to have. Of course, hope is not a passive thing. It's optimism plus a plan. And this is where we admire Dave, because he's getting on and doing things. But actually, because this epidemic really came on pretty quickly, if we do the right things, we could turn it around in in a relatively short period of time, but it will require doing the right things. And it's not simply a matter of saying, actually, people just need to make better choices. Guess what? At the same time as our obesity epidemic has grown, smoking rates have declined precipitously in this country, particularly amongst young people. Yes, vaping now has become an issue, but it's not because suddenly Māori and Pasifika kids decided, oh, well, gosh, we were wrong all that time. We changed the environment. And if you put in place a comprehensive program to address this with strong political leadership, we can and should turn this around.
Yeah, absolutely. So, we've heard a really clear, cogent, and compelling argument put in place here that we know what needs to be done, and we know that it's effective in other countries, and in comparable parallel examples in New Zealand, such as tobacco, we know that these regulations are effective, and yet we've hardly seen any action on this and on food environments in New Zealand over the last 30 years. So it's a question really for all the panelists. Why is this such a difficult issue for New Zealand to act on, presumably for the New Zealand government to act on over such a long period of time? What would have to happen for there to be sufficient political will or cross-party consensus for the kinds of policy mechanisms to be implemented in New Zealand that we know work in other countries? I'll throw that open to all four of you.
Happy to make a comment just to kick things off here. Actually, we did have the makings of a pretty comprehensive program in between 1999 and 2007 under the namesake of this foundation. Helen Clark is Prime Minister and Annette King is Minister of Health. Of course, then others, Pete Hodgson, David Cunliffe. People may remember the Healthy Eating, Healthy Action program of work, which was intended to be a full program. It was a start, and it didn't include too much on the regulation side of things. But what it did include is attempts to try and modify the food environment in school, including in school settings, in healthcare settings, and other places. And it's just unfortunate, I think, that different governments have sort of come in and used this as a little bit of a political football, that it's nanny statism. It is nothing of the sort. Adam's pointed out it could be more nanny state, and other countries, including those with right of centre governments, have been able to take much more deliberate action and specific action on this. So I think, I'm on my phone, but I think one of the comments that went up was about the importance of a sort of social license and social momentum. And it's clear if our politicians are collectively seem to be too timid, I'll use that word, to actually take action. But let's hope there may be some who can stand up, and we've had that in the tobacco control area. People like Helen Clark back in 1990, then Tariana Turia, picked up the baton and did some amazing work, real political courage. But really it needs that social momentum, that social license. And I guess it's thinking about how can we really create that social license where politicians, in a sense, are forced to act because they see it's in their political interest to do so.
Yeah, I agree with Dr. Ashley there. It's because, look, with these political parties, it's all about, and look, any government, it's a popularity contest. They don't want to make these tough decisions because they're worried about it affecting their popularity and affecting the next year's election. We all have the power at next year's election. So this really does need to be a political issue, and we've just got to keep raising it because it's just a tsunami. It's a tsunami of need that's coming, and our health system's already overwhelmed, and it is not going to be able to keep up. And there's plenty of research to back this up. We already know what works. We've got to stop talking about it, find some political allies, and make this a political issue next year. But then the trick is actually keeping them to keep their word once they're in. That's the hard part.
Yeah, just to add to what's been said, and I completely agree with the perspectives that have been put forward. But I think this is it's too big an issue to be so politicized. But I think what New Zealand lacks is a national strategy, a national plan around food in general. So we're talking here about a specific aspect of food around obesity and healthy foods and the consequences of that. But as Ashley pointed out right at the beginning, New Zealand is a major food producing nation. Food has major consequences for our health, but also for our planet. Alongside obesity and diet-related diseases, we're also experiencing a lot of our tamariki and a lot of our communities are experiencing food insecurity. So food is a really big issue, and I think it's one that it really deserves to be elevated above cross-party politics and to be it would be amazing to see a national food strategy that was a cross-party initiative with some ring-fence funding. I think that could make a huge difference. And Ashley talked about healthy eating, healthy action, which was a really great starting point. But I think we need to it needs to be a cross-party initiative for it to have longevity.
Thanks, Glenn. Adam, you've talked a little bit about how this worked in the UK. Any reflections on how it might work in New Zealand?
I think the UK is an interesting example as well because there's been a lot of studies into into the number of policies that have been implemented and the varying levels of success. And so we're sort of here as like the genesis of this webinar is a report that I wrote with Jamie Oliver a few years ago on obesity in the UK, and we cited a statistic in there that there have been 689 different policies on obesity over the last 20 or 30 years, and rates of obesity continue to climb unabated. So there's clearly something that wasn't going right. One of the things, I've got quite a few comments, I guess, but one of the things that is really interesting that Ashley was referring to this before is around sort of people's choices in the agency, and I think it is important to not deprive people of their agency in this as well, because people do have a self responsibility, right, about making healthy choices for themselves. But obviously, it's really, really difficult to do that in certain environments. So, like, when you go to a supermarket, you go down like the chocolate and lollies aisle, and it's the most honest aisle in the whole supermarket. You know what you're going to get when you're going down there. So you're intentionally choosing to go get chocolate and lollies. You know that it might be bad for you, but that's fine because you're making that choice. But when you are a parent and you're going down and you go to buy cereal, you get Nutri-Grain or something, the on the front pack of Nutri-Grain it says high in fiber, high in B3, high in protein, really nutritious for you. Yet one serving of it has almost a full recommended daily intake of a child's sugar. And so this is sort of these hidden choices and the hidden sugars and stuff that are out there. It's not necessarily the fact that there's lollies and chocolate there, because we all know that's bad for us, but it's the things that we don't know that's bad for us that need to change.
Thanks, Adam. So a reminder that in a couple of minutes we'll switch to audience Q&A. If you haven't got your questions in, please do that now. And please also have a look at some of the other questions that are there and put a thumbs up next to the ones that you'd like to hear put to the panel shortly. I'll put one more question to the panel before we get into the audience Q&A. And that I'll put it to everybody. And this is a question about some of the new medical treatments for obesity that have been emerging over the last couple of years, and their role versus that of prevention. So we've seen the development of many new treatments for obesity, such as the GLP-1 weight loss drugs like Wegovy and Ozempic. What role do you see for these treatments in addressing New Zealand's high obesity rates? How can the health system ensure that investing in these expensive new treatments does not inadvertently become an excuse for politicians to avoid the harder, but probably ultimately more effective work of improving the food environments in New Zealand? So that question to all of you.
Yeah, I'll start on this one. Thanks. I'm not against these drugs at all. People think that I am. People think that I'm against these drugs and that I'm against the operation. Gastric bypass, all these things. I'm not. But you cannot prescribe your way out of obesity and break in these cycles. They have a place, they're an aid, but they better be done with a healthy lifestyle program where you're educating those people. Because just getting the operation or just taking a pill does not change how you're feeding your children. It does not change the environment that you're living in. Doesn't change your habits. Doesn't change your mindset. So that it's really a short-term thing. You've really again you just you know there's an obesity clinic out there that they got I think 1.6 million or something in the first year, with people are giving Optifast to get them skinny enough to get the operation to qualify. It doesn't mean they can actually get it, because they might be able to afford it, and they might not be able to get it funded, right? A program like ours got 200,000 for the and so where is the equity there? If you're going to invest in these things, you better be investing in programs like ours that are lifestyle based programs that deal with the whole family as well, because these things don't they take the hunger away. So if you take as soon as you finish taking Wegovy, if you can't afford it anymore, the hunger comes straight back, and you're still living in the same area, you still have the same habits, you still have standing around the same people, and on goes the weight again, and in most cases more.
Thanks, Dave.
I've got a slightly complementary but also slightly different point of view on them. I am a huge advocate for anti-obesity medications, weight loss drugs, and I think they're a generational opportunity to actually disrupt how we approach prevention, and actually the natural next step in prevention's evolution to adapt to scientific and technological change. So like just sort of thinking about people's behaviors and the sort of like food they consume when they're on them. I think that they if we're looking at places like the US where they've been used so widely, what we're seeing is that people are changing their shopping and eating habits, creating ripple effects across the food industry. So in McDonald's in the US, they forecast they'd lose 28 million customer visits annually from which is about $482 million a year, which is about 1% of their sales, because of the effect of GLP-1s, of weight loss drugs. While there was a large US investment fund that divested entirely from the alcohol industry because they saw that there was no future in it because of weight loss drugs. And so you're seeing these previously immovable food industries and alcohol industries that are being shaped in real time by these technologies. And there's certainly like issues there around, some of the longevity and how long people can be on them. And I think they'll eventually be worked out by technology and innovation. But there's a real big opportunity here for governments to use these as a strategic lever to actually reshape the food environment in the way that they think it should be. And like so I think there's a huge opportunity here, and like then it creates a space, right, by affecting the bottom line of these food industries to actually bring them to the table to say, okay, so we don't want you to market food in this way anymore. Because there are examples, right, in London I know of some food companies that are selling smaller portions because they want to cater to people who are on weight loss drugs. And organizations, I think there's another company, Nestle as well, is starting to sell specific food that is targeted directly to people on weight loss drugs as well. So I think there's some really interesting examples here of how the food environment is being reshaped in real time by these drugs. And that's like quite like different, like creative way, but it's a way for, I think, government to be able to try and leverage them strategically.
Thanks, Adam. Ashley, I imagine you've thought about this.
Yeah, well, let me start by saying I think there is absolutely a place for these drugs, as there is for surgery, which can be life-saving for some people, profoundly life-saving. And the challenge is, of course, access. And I worry a little bit about inequities in access to the drugs, because I think that I have a sense that a reasonable proportion of the users are people who are overweight, and it's a good way to help just with their general keeping their figure. I'm a pretty optimistic person, but I had to say I'm not near as sanguine as Adam is about these. I think it's what you're describing, Adam, is very much around the margins. A 1% change in the amount of McDonald's being sold in the US, it's going to take a long time to create the shift we might be looking for. So I think, and governments, particularly now, are not particularly well known for using these things in a strategic way. If you're arguing that they could create a strategic lever for changing the food environment, I think there are ones that at the primordial and primary prevention end are much cheaper. Be a very expensive way to use these drugs to try and strategically change the food environment. Notwithstanding that I think there are people who would benefit from and deserve access to these drugs.
I too am supportive, but my biggest concern is around inequity, because these drugs cost about $600 a month at the moment. They're not subsidized. So, the risk of increasing the inequities that we already see in obesity and diabetes and related conditions, I think is enormous. But also, we don't know a lot about the long-term safety of these drugs. They haven't been around long enough for us to understand what the long-term consequences of them are. And they likely only really work as long as you're taking the drugs. So that's, a very big cost implication for people who do want to use that treatment. And I'm sure it can be life-changing for some people, but it's just not going to be accessible for most people.
Thanks, Cleona. So we're going to move into audience Q&A now. And we've got a very popular question about the removal of home economics and food and nutrition education from the senior curriculum, and whether that will impact the future well-being of New Zealanders, given that the subject is an important avenue for educating youth about nutrition and ultra-processed foods. So, who would like to?
Look, that's actually a disgrace. If you think that this knowledge for a lot of parents who are working, the cost of living, a lot of parents working multiple jobs, there's no more time to educate the children on how to cook healthy, how to shop healthy. The parents, if they're coming home, they're tired, they're working multiple jobs, they get whatever's available to them that's always cheap and nasty crap. And around that cycle goes, the kids don't know how to cook healthy. And now they're not even being taught it at schools. I tell you what, I never once used algebra. I've never used calculus in my 46 years of life and owning multiple businesses. But I wish I knew what GST was, and income tax, all these usable life skills. And this is one of them. It's a disgrace that it's been taken out.
Yeah, I think the message that it sends is really worrying. The fact that, we're saying that nutrition and health and cooking and home economics are no longer as important as anything else. So, I think with a lot of what we're talking about, we have to be thinking about what messages are we sending to society all the time. And so whilst I don't think there's any one thing that is going to reverse the whole tide of obesity, I think we absolutely have to be thinking about a kind of a comprehensive approach, as Ashley said. And home economics and nutrition and cooking and health are part of that. They're a really critical underpinning of that comprehensive approach. To do away with it, I think, is sending the wrong message to our children and to our families and communities.
Yeah, great. Thanks, Cleona. Connected to your previous answer, Dave, is another question here about whether there is a connection between the fact that people are needing to work more, sometimes at unconventional hours, and whether that makes it more difficult for people to come home and cook, leading to the purchase of junk food instead. Is that something you've thought about at all, Ashley, in your context of your work as New Zealand's senior health official?
Yeah, I think the key point here is let's call it the obesogenic environment doesn't sit on its own either. And, if arguable, and as we know and has been canvassed in this discussion, obesity is socioeconomically and ethnically patterned. There's no that's just not a coincidence or an accident. So behind the rates of obesity and both child and adult rates of obesity sit a complex web of socioeconomic factors. And so, work, education, income, neighbourhood, all these things play into this environment as well. And so, again, just to reiterate the point, and Cleona has just made the point as well, actually it requires a comprehensive look at it. But the point here is this is the public health challenge of our time. I mean, arguably global warming is a pretty major public health challenge, but this is one, it's linked as well to global warming, our food environment, obesity, non-communicable diseases, they're all linked. This is the one that is imminently preventable. It will have an impact and is already having an impact on so many dimensions of our society and indeed other societies globally. It needs a really comprehensive approach to it, and whether that's galvanizing around a food strategy or thinking about what is the way we want to feed our population now and into the future, and how do we want to impact on health and well-being through nutrition globally, where we could be doing so much more in these areas. So again, just, arguing strongly for a comprehensive approach to this. And I think under the Healthy Eating, Healthy Action program that we had through the early 2000s, we were starting to get that sort of traction.
So that's a great link to our next question here from one of the Foundation's Honorary Senior Fellows, Lucy Castles. Lucy agrees with your point, Ashley, about the regulatory environment and the need for decisive decision making from the top here. And she finishes with a question: what do our panelists think about the prospects for better cross-partisan consensus in favour of healthy foods and healthy food regulations in New Zealand? I don't necessarily asking you to turn on your crystal balls here, but can you see a pathway by which we do actually arrive at sensible, durable, workable policy that really addresses this issue in New Zealand? How might we get there? Question open to everybody.
Well, geez, we're hopeful, aren't we? No one wanted to answer it. It's I don't know. I hope so, but I mean, Dr. Ashley, I mean, you've dealt in this world a lot more than us, I guess, in terms of the political spectre here. Well, what's your thoughts? Because
cross-party consensus. I mean, thanks, Dave. It's a challenging question, especially at the moment when we find it probably increasingly challenging to get cross-party consensus on issues. Although there is certainly discussion about that around things like infrastructure. Myself and others have been putting the idea of a stronger cross-party approach to 10-year planning for our health system if we're really going to address the underlying issues. It's how's that incentivised? Again, politicians will respond to social license, will respond to public pressure on this, and that's really something we need to create. But if we think about, the future well-being, the prosperity of our country, this is something that sits right at the heart of economic, social, cultural, environmental well-being and prosperity and sustainability for this country. So it's really just thinking about how we can create a sense of shared purpose around that. And in my discussions around the health system and how we go with this, probably the best advice I had was get a strong alliance of groups and people and communities around it, and then wait till the politicians get FOMO, and then they'll want to actually be part of it. I'm not sure what the way forward is on that, but maybe organisations like the Helen Clark Foundation can perhaps act as a point of for galvanising that broader cross-societal momentum that is needed.
I think you're right, Ashley. And the Helen Clark Foundation definitely needs to be. I mean, next year is a big year because it's election year. They will all these politicians will all be back in our community hubs, getting their photos, having their press conferences there. That's the time when we all galvanise together and put it on the line. So you want our support? This is what needs to happen.
Thanks, Dave. We've got an interesting question from Dylan Joffe here about ingredients. So many ingredients that have a poor impact on health, including high sugar, high saturated fats, are relabeled under other names to avoid putting off consumers. with familiar unfavorable ingredients. So from a regulatory perspective, Dylan asks, do you think that restricting or further regulating this practice may improve some of the poor health impacts caused by the hidden ingredients or additives? Any thoughts on that from our panel?
Yeah, I think it's a really good point. Sugar goes by many, many names, and I think from memory in Australia and New Zealand, because we have joint labeling regulations, there's somewhere in the region of 30 to 40 terms that can be used for to describe different kinds of sugar. I know that Food Standards Australia New Zealand has been looking at grouping all of them under sugars, for example, on ingredients labels. But of course, that relies on people reading labels. And, that is not always a priority for everybody. And those labels are quite technical as well. So whilst I think it's good that there are moves being made to recognize that labels are confusing and to try and simplify them and make them clearer, I think labeling often relies again on individuals to be making difficult choices in an environment that makes it hard to make healthy choices. So I don't think I don't think on its own, again, it's going to solve the problem, but it could be part of a comprehensive approach. Better labeling in general.
Great, thanks, Cleona. A quick heads up to the panelists that will finish in a couple of minutes, and I'll give you each an opportunity to leave our audience with one kind of take-home message that you'd like them to focus on. But before we get to that, we've got a question here from Claire Wall. What is the panel's view on targeted assistance programs which support families with purchasing healthy foods? Examples overseas include the Healthy Start Scheme in the UK and the SNAP, Supplementary Nutritional Assistance Program, I think it is, in the US. Do we think those have relevance, applicability in New Zealand? Adam, do you want to jump on that one, or shall I assign it elsewhere?
There's a huge amount of expertise in that one. Sorry.
Sure. Does anyone want to take a shot at that one?
Well, it's another fiscal approach to supporting people to eat more healthily rather than taxing unhealthy foods. It's an approach to support families and communities to eat healthily. And yes, there are examples of really good programs in the UK and the US that do that. And there's lots of research that shows that if you make healthy foods cheaper, that people will eat more of it. So again, I think it's something that we could look at. Politically, it's often not highly regarded because of the fact that the funding for those programs has to come from somewhere else. But that's where actually a really nice approach might be to introduce something like a sugar sweetened beverage tax, and potentially use revenue from that to then subsidize healthy eating programs in our schools or in our communities.
Great. So we'll finish off with a question on the use of specific words like tax when we're looking to implement effective regulation that will make a meaningful difference to obesity rates in New Zealand. And Ashley, you and I have talked about this offline, and I know you've got thoughts. So Cynthia Anderson asks a question here around the importance of getting clear messages into the mechanisms that we use here, and ask specifically about the use of the word tax. I wonder if you've got any thoughts on that, Ashley, and then I welcome any thoughts from the rest of the panel.
Yeah, the problem with tax is, again, it's politically charged. It's not just in New Zealand, and I prefer something more generic, like the use of price instruments. We use them across. We use them all right across society in a whole lot of ways. So I think this has been the challenge a bit with the sugar sweetened beverages tax. As soon as you say tax, you can say levy or whatever, then it just becomes a bit of a lightning rod then for a political response. And I think avoiding that as much as possible would be good. Perhaps because I'm looking at the time, very quick closing comment. Do be hopeful, do be optimistic. There has been some great work done here in New Zealand. And some of that has used regulation and different price instruments, but some, like the work of the National Heart Foundation, working with producers to reformulate things, and I'm thinking particularly around the amount of salt in bread. If you reduce it over time, people do not even notice. Same with potato chips. I can't eat potato chips anywhere in Europe because they've got 4 to 5 times the amount of salt that our potato chips have here. At a population level, and I like potato chips, I'm just fessing up here. At a population level, these things make a real difference. So there are things that can be done. The carrot and the stick approach is the way to go.
That's a really great note to end on. Thank you, Ashley. The sense of be hopeful that we can do this. I'd like to offer the same opportunity to Cleona, Dave, and Adam. What's one thing you'd like to leave our audience with today?
I think we have a real opportunity to join up initiatives to reinforce each other. So we've got lots of great examples like Dave's program, and Ashley just talked about the Heart Foundation. But actually we have opportunities if we brought in things like a sugar sweetened beverage tax pricing instrument, mandatory labeling, things like that, but where we could actually build on those initiatives and use each of them to reinforce each other. I think that's the way to go.
Thanks, Cleona. Dave, last message.
Yeah, echoing those points, to be hopeful, it's possible. Like Dr. Ashley Bloomfield said before, we can turn this around. It is possible. But my word for the day, or a couple of words, is cut the bureaucrat. Bureaucrat. Breakfast me at your next meeting. Bureaucrat. Cut all the bureaucrat. Don't let bureaucracy stop you and get in the way of helping people. And that's what needs to happen.
Thanks, Dave. Adam.
Mine, I'll go quickly touch on weight loss drugs. I think much like any technology, we underestimate the impact that these will have in the long term. And I think that in 5-10 years time, the large majority of the population, whether overweight, obese or not, will be on some form of GLP-1. I think that is a great thing for humanity to be able to leverage the technology and the innovation that is being unleashed.
Well, thank you all for joining us today. This has been a particularly high engagement session. I see we've got well over 100 comments in the chat and almost 50 questions, which is might be a high point for us. I think it's indicative of an issue where people feel very strongly. We can see that there's a really big challenge facing us in New Zealand, but to the point made very eloquently by all 4 panelists today, a very clear pathway forward that if we want to seriously engage with this problem, there are proven mechanisms available to us, and it's really just a matter of political will. So hopefully we will see some of that in the months and years ahead. Thank you very much to Dr. Sir Ashley Bloomfield, Adam Bradshaw, Cleona Namuku, and Dave Latelli for joining us today. That was a really stimulating and hopeful exchange. Thank you to all our members who help make discussions like this possible. If you're not a member and you enjoyed this discussion and you'd like to see more like it, please do consider becoming a member. We'd love to have you. But for now, ka kite anō. Thank you all for joining us, and until next time.